talked about waveform capnography before. But today we're going to give you some examples. For each of these examples, we're just going to give you a little bit of time. This way you can think it over and come up with an answer. But I really want you to commit to an answer before advancing the video. The first waveform is this. This right here is the terminal bump. And we spoke about that before, and we said that is a normal variant for patients who are obese or pregnant and sometimes seen in pediatric patients. So that is just normal. Let's move on to the next example. And I'll give you a hint. This is a patient that presents with shortness of breath. Now notice what's different here. In a normal end-tidal CO2 waveform, we see a squared off plateau phase right here. But here what you're seeing is you're seeing a slowly ramping end-tidal CO2 until we get to a peak. This is known as the shark fin waveform, but more specifically, an obstructive type of pattern. So you can see this in patients with asthma or COPD. There's an obstruction to expiration here, and that's why you see that slowly ramping up waveform. This is a very helpful waveform as I'm managing patients who have asthma, because as these patients get clinically better, what you'll notice is that their waveform tends to become more squared off and look more like this when they get better. So I don't have to keep popping back in the room and auscultating their lungs. When I see that they are physiologically better with their end-tidal CO2, I know that they're getting better, along with looking at their vital signs and clinical stuff, all that stuff that you know.